ahead.
Is it live now? Is it live?
Yes, you are live.
Thanks. Very good evening, my dear viewers. I very much welcome you on this very August of Education Pe Charcha. My dear viewers, those who are our avid viewers who definitely reckon with this fact that Education Pe Charcha is synonymous with educating the nation. My dear viewers, we are into 97th session today, and just it is just 3 sessions more before we are going to finish or going to complete. That is the centenary session. We'll be celebrating the centenary session. My dear viewers, on this very important occasion, I just had to make an announcement before I kickstart today's session. Actually, a couple of months ago, the People's Chief Secretary of Bihar, a senior IAS, the Sri Anjani Kumar Singh ji, who happens to be the Director General of Bihar Museum today, had suggested to me that why don't you make it, why don't you document the whole program of Education Pe Charcha? And then, after churning out with my team members, even Pramodji was a part and parcel of that, we have decided to document Education Pe Charcha after 100th session in form of a book. I am an author of pioneer book in the world, The Living Legends of Mithila, and Hindi version Mithila ke Adhunik Diggaj. So in the same way, we are going to document around 40 of our topmost achievers thus far on Education Pe Charcha, in the wake of the conclusion of 100th session of Education Pe Charcha. So this is the way we are going to document our session of Education Pe Charcha, because it is a revolution in the nation, in as much as the avowed mission and vision of Education Pe Charcha is to educate the nation, albeit in its microcosm. My dear viewers, having said so, definitely, I would like to, express my deepest thanks, sense of gratitude to Drishti Talks for facilitating this show, and which is spearheaded by Sri Pramodji, who happens to be a very valued partner. My dear viewers, we are, as I already said, we are into the 97th session, and of course, in continuation of the series of our sessions, we have invited one of the topmost achievers. Rather, I would say he is the most qualified, eye surgeon from the state of Jharkhand, and that too at such a young age. He has become a flag bearer of or rather an apostle of a new dawn so far as the medical fraternity is concerned. Dr. Vibhuti Kashyap, the deputy director of Kashyap, that is Kashyap Eye Hospital, Kashyap Memorial Eye Hospital here in Ranchi. My dear viewers, I have had a very intellectual interaction with that of Dr. Vibhuti Kashyap ji, and I am vouching this particular fact that he happens to be the most talented face of that of an eye surgeon in the entire state. Not only he happens to be an alumnus of that of All India Institute of Medical Science, Delhi, along with the super specialty degree from AIMS. And then, most importantly, he happens to be the only flag bearer of that of the pride of being a double FRCS, and that too from Glasgow and Edinburgh. Both the premier institutes in United Kingdom, the only face of double FRCS, apart from being an alumnus of that of All India Institute of Medical Science in Delhi. Dr. Vibhuti Kashyap at such a young age is a revolutionary in the field of medical science. As to how I am outright dubbing him as that of a revolutionary, as the program will progress, we will be unraveling his holistic persona, that at such a young age, how could he do such a great miracles? Because Kashyap Hospital in Jharkhand or Ranchi is the best eye hospital across the state, and one of the best in the eastern regions and at the country level too. Now, I very much welcome Dr. Vibhuti Kashyap, because we have 10 questions to consider for this show, and without wasting even a single precious minutes of ours, as I already said, a little bit of introduction. Dr. Vibhuti Kashyap, The only AIMS New Delhi trained FRCS, that is Fellow of Royal College of Surgeons, qualified Vitrio Retina Surgeon of Jharkhand, has a rare distinction of being called a double FRCS from Glasgow and Edinburgh, Deputy Director of Kashyap Memorial Eye Hospital, Ranchi. I very
Thank you,
much
sir.
welcome Dr. Vibhuti ji. Sir, here goes the very first question to you. Walking down the memory lane, if you could kindly enlighten our viewers about your sophomoric years culminating in your passing out MBBS from Medical College in Mumbai. Of course, aims and all will follow in second question. Please, sir, Dr. Vibhuti Kashyap ji, our August guest for today's session. We welcome you, Dr. Vibhuti Kashyap ji. Please.
Thank you, sir. Thank you for such an enormously heartwarming introduction. And I must say I'm overwhelmed by the kind of introduction you gave on your platform. So to answer your question, so I after passing my after doing my matriculation, I joined Delhi Public School Ranchi for my +2, and there I took up biology as a subject, of course, because I wanted to be a doctor. My mathematics wasn't that great. I barely could remember or understand mathematics. So I used to actually mug up most of the numericals or most of the questions just enough to pass my exams. So I knew that mathematics is not something made for me. So I took up economics, and I was very good at economics. And then I passed out from DPS Ranchi from class 12th in 2006. And I was the school topper over there for the 06 batch from the science section. And my name is still there, etched in the toppers list that the DPS Ranchi board has. And from there, I I qualified for the All India entrance examinations. I had a 700 rank All India. But at that stage, because my expectations were very high, I wanted to clear AIMS for my undergraduate as well. So a rank of 700 wasn't going down very well with me. So I had decided, if I'm going to a government college, I'm going to AIMS. If I'm not going to AIMS, then I'm going to go to the best private medical college. And that's why I chose Manipal. And I did my undergraduation from Kasturba Medical College, Manipal, from 2006 to 2007.
Pramod ji, sound is coming from background, please. Pramod ji, yes, sir, please.
आओ इधर ऊपर में हमें दुहा.
Pramod ji, sound disturbing, please. Pramod ji. Hello. Yes, please continue. Dr. Saab, continue.
Yeah, so I did my MBBS from 2006 to 2011. So for those 5 years, it was a life-changing experience for me, or let's say it was a life molding experience, a personality molding experience for me, because not only did I learn things professionally, I also learned how to develop my personality. And because that place had many people from all over the world, so you could have a cultural amalgamation with everybody. And there I had the opportunity of having a hybrid culture, a hybrid personality, which inculcated the culture that I had from my childhood and my upbringing, and also inculcate the values of those people who are living abroad after understanding what their lifestyle and what their culture is. So basically, I had my good fortune of having the ability and having the opportunity to have an amalgamation of a pretty amalgamation of all good points from all people all around the world. And then after that, I prepared for my master's, or the so-called MD entrance exams. And then I had the good fortune of being able to crack the AIMS entrance exam. I had an all India rank of 28. And when I went for the counseling, usually ophthalmology as a subject is lesser popular. So whenever there are toppers who are under top 30, top 40, they usually go for branches like radiology, orthopedics, medicine. At rank 28, when I went there, I was the first person from rank 1 till 28 to choose ophthalmology. So over there, the person who was allotting the seats, he was also surprised when I chose the subject. Little did he know that this choice comes as a result of a very heavy and a very, very strong and a very, very illustrious, needless to say, background of 3 generations of ophthalmologists, both from my mother's side and my father's side. So this is all about my sophomore years, and this is how I ended up at AIMS.
Great, great. My dear viewers, let me say, even though it is a bit private affair, but nevertheless, I feel like disclosing this. When I had an interaction with Dr. Vibhuti Kashyap, at his chamber, I was low, even though I stood closeted with him barely for 40 minutes. But the sort of professor, the way I jailed with him, in fact, I felt like I was very much at home, because being, means a lover of English language, and in fact, the sort of corresponding, the response I got from him, which was adequately self-manifest, the way he just, he introduced himself, on this platform with the economy of words, but nevertheless, being very incisive in terms of introduction, that would have given us, all of us, an impression of, he's being a very, very, he's being economical, or he's being precise with the words, but of course, exactly in the same corresponding measure, being absolutely proficient as well as efficient in terms of surgery. So what he means very skillfully, what he amalgamates, or what he blends or presents, is that of the combination of both economy of words as well as the proficiency or efficiency in terms of surgical operations. So that has become quite self-manifest. Thank you, Dr. Saab. Now I'm coming to the second question straight away. You did your post-graduation from All India Institute of Medical Science, Delhi, along with super specialty course from there. My dear viewers, it becomes incumbent on my part, even though I'm not from medical background, but nonetheless, it becomes a very, quintessential part of the communication, that rarest of rare are those fortunate doctors or fortunate people who do their post-graduation from that of AIMS successfully, means come out with the flying colors, with an additional feather to their crown, that is of super specialty. What it is, he is the best person to explicate on the same. Yes, Dr. Saab. So what is the super specialty course, which only few successfully do it? If you could kindly apprise our viewers on the same. Please, sir, your take on this.
So basically, ophthalmology is a very vast subject, and it has multiple subspecialties. So when you do your master's in ophthalmology, you become a general ophthalmologist. So that is what master's course is. So you become a specialist in a very broad perspective. So broadly speaking, you are a general ophthalmologist who knows a bit of everything, but a master of none. And then comes the time for super specialty, when you choose a particular subspecialty, and then you try to master yourself in those subspecialties of ophthalmology or eye. So I had, you can say luck, or you can say hard work, whichever way you put it. I would say probably I was destined. So I had an opportunity to do my super specialty in 5 subjects of ophthalmology. So I did it from, I did my specialty in retina, in uvea, in retinopathy of prematurity, of course, in cataract surgeries, and in refractive surgery services or spectacle removal surgeries. So these were my 5 subspecialties. Now, I had to basically work in the unit of AIMS, which dealt with these cases. To work there, you have to qualify an exam called a senior residency exam. So when you qualify, and I was from a general quota, and you know that, as long as, when you don't have reservations, or when you don't have a quota, like a ST quota, SC quota, OBC quota, or a handicap quota, whatever quota, it becomes very difficult. So in my time, there were only 3 seats in general category for senior residency. And out of those 3 seats, there were only 2 seats in the retina specialty. So I was one amongst those 2 people all over the country who could qualify that. So it was it was very, I would say, fortunate, because I don't think that anybody else who was appearing in that exam was any less than me. It's just that after a certain amount of hard work, it just depends on whose day whose day was it on that particular day. And I was lucky that it turned out to be my day. So I cracked it. And then for the next 3 years, what followed was a very, very rigorous a period of training, less hours of sleep, very long hours of OT, very, very long hours of casualty duty, very, very long hours of, a lot of things which defines today who now currently I am at present. So this was my journey from 016 to 019.
Great, Dr. Saab. My dear viewers, we common people, we have seen Three Idiots, and we know the way engineers, especially in IITs, the students, the way they toil. But here the doctors, ordeal by fire, possibly most of us are not aware of. They really, as Dr. Saab just now, our esteemed guest has just now articulated, they barely get 3 to 4 hours to sleep. During that those arduous days when you are struggling to become a doctor from All India Institute of Medical Science. So it is no less an achievement, in fact, a milestone achievement from there, just doing PG from that of AIMS. But, in addition to that, the super specialty about which he tried to share his own experience with us, indeed was a feather to his crown, or it happens to be a feather to his crown. Thank you, Dr. Saab. Great. Sir, I'm just coming to the next question straight away. You did your double FRCS. My dear viewers, FRCS means Fellow of Royal College of Surgeons. It is the best person our esteemed guest will be explicating on the same. Sir, you did the double FRCS from United Kingdom, Glasgow and Edinburgh. My dear viewers, just to share by way of my own experience, I was teaching British Chartered Accountancy once in Delhi, ACCA, Association of Chartered Certified Accountants. It too had its head office in Glasgow. And since our very, very esteemed guest has done his medical degree, that FRCS, from that of Glasgow, one of the most prestigious medical institute, in UK and across the world, it is unequivocally indeed a great, great achievement. Sir, continuation with the question. You did your double FRCS from UK, Glasgow and Edinburgh. In fact, you are the only surgeon. I am underscoring and rather emphasizing on this particular term that you are the only surgeon in Jharkhand with double FRCS. If you could kindly underscore, that is, if you could kindly highlight, it would be the more appropriate word, the certain special features of the same for the understanding of our viewers. Please, Dr. Saab.
So FRCS, as you rightly said, stands for Fellow of Royal College of Surgeons. Now it has multiple FRCS is done under multiple headings. One is under Glasgow, one is under Edinburgh, one is under Canada, one is under England. So basically what it does is it is a degree. It also is a quality mark. So there is a difference between an MRCS or an MRCP and a FRCS or an FRCP. So the difference is that when you say you are an MRCP or you are an MRCS, you basically are a member of that Royal College of Surgeons, and anybody can become a member of the society or by paying a certain amount. But you cannot be a fellow just by paying. You have to actually pass a very standardized test series to actually be called a fellow, F. So F stands for a fellow. So fellow is a proper degree. So when you say FRCS, you have a proper degree which you can apply under your name. Now, FRCS usually has 4 parts. Just like if you have to do a matriculation, you have to pass through 10 classes. The same way, when you have to do an FRCS, you have to pass through 4 tests. There is a part 1, there is a part 2, there is a part 2A, there is a part 3. So part 1 is a very, very basic examination which just deals with very basics of ophthalmology, which is a simple cakewalk to pass. Then comes a step 2 where your clinical acumen is checked via certain questions. Then comes a step 2A where you have to write essay questions about a certain condition that is presented to you medically. in the paper, and there are 5 to 7 such questions. And then there is step 4. Now, step 3, that is the fourth part, is called the step 3, because second part has 2 and 2A. So the step 3 has 2 parts again. First is the viva, where surgeons and doctors from all over the world, UK, Africa, probably Australia, Indians, all of them, they come, and there is a round table of 8 doctors who sequentially ask you questions pertaining to the science and also pertaining to emergency medicine. You have to not only be an ophthalmologist to be to actually be an FRCS. You have to also be well versed with what to do if there is a patient who is in emergency, like who is in a do or die situation. You need to be an expert in that too. So there is a viva station for emergency medicine also. Only if you pass in those stations, then you have something called as a practical station the next day, where there are again 8 stations. 8 stations has 8 different kinds of patients pertaining to 8 different subspecialties of eye, having 8 different subspecialists from all over the world sitting with that patient, and you are given just 6 minutes with each patient. And after those 6 minutes, they can ask you anything relevant to that patient as to what is your diagnosis, what do you think this is, what else do you think it can be, how are you going to manage. And only if they find your answers and your approach, your diagnosis, your every single thing to be in line with the international protocols, you are considered to pass. And you have to pass approximately at least 6 stations out of those 8. And when I say pass, it's not like a marking system. When you say pass, it's a pretty strict line. There are certain prerequisites. If you are able to crack those, then okay, you are doing good in that, so you are pass. There is no marking system like a 90%, 80%. Either you're a pass or you're a fail. So there are pretty stringent criteria on what the doctor is judged. And only after you pass on those stringent criteria, you pass that station. And there are 8 such stations, and you have to clear at least 6 stations. Not that you will not know anything about the other 2 stations, but you not only have to know it, you have to actually master it according to international protocols to be able to pass it. And only after you crack that step 3, and then the marks goes for scrutiny, and then it is that you are awarded a fellow of Royal College of Surgeons. And that is what I appeared for. That is what I gave. And by God's grace, today I have 2 FRCS, one from Glasgow, as you said, one from Edinburgh.
Dr. Saab, actually, just from the point of view of our viewers, I would just like to, elicit, rather a clarification at your end. You have done 1 FRCS from Glasgow, it is well and good, but or Edinburgh, whatever it may be, in terms of the sequence or in terms of precedence. But we would like to know, especially our viewers would like to know, that why is it fashionable to obtain 2 FRCS, or does it add value to a candidate who obtains degrees FRCS from 2 different places? What is the actual, the benefits which flow to a candidate? Please, sir.
Sir, basically, FRCS doesn't have a value in India, so much to say, because in India, you don't need FRCS to practice. But in places like there are certain places in the world where you need FRCS to practice because they want to have doctors who have international protocols. So in those places, you are given a preference, you are given a higher pay, and you are considered as at a high regard. In India, because there is no addition to what you, you will do something only when it adds value, money-wise, or probably job-wise, or if it is a prerequisite. So it doesn't add anything like that in Indian scenario. That is why Indian doctors, they don't, they don't put the effort of going through for FRCS because it's not needed. You don't need an international protocol to work in a place like probably Ranchi or probably, Delhi, wherever. But my point of doing FRCS was that I wanted to be the best possible quality I wanted to provide the best possible quality that I can. And when I have FRCS, I can be sure that whatever I am talking, whatever I am doing, whatever my approach is, it is in sync with the international protocol. It is in sync. It is an internationally accepted standard that I belong to. So that is basically for my own standardization. It is just like an ISO mark or probably an NABH certification. An oil can be a non-ISO mark and can be an ISO mark too. And I'm pretty sure you are going to choose the cooking oil, which is ISO mark. So why do you choose that ISO mark? Is it fashionable? No, it is an indicator of standardization. It is an indicator of a particular level, a particular standard. And though not essential, I would want to have a stamp of the authority that clarifies that I am of that particular standard.
Fantastic. Fantastic explanation. My dear viewers, as our esteemed guest has very well, actually, I wouldn't dub it as a conundrum, but nevertheless, for the sake of clarity, we wanted to elicit a response from that very gentleman, from that very person who holds double FRCS. But one thing I would like to outline here, I would like to underscore here that even though it might not be required in Indian scenario, but nevertheless it adds value, it adds to one's prestige. Or else why we see in Calcutta, Bombay, Delhi, Mumbai, Delhi, even in Ranchi, or in Patna, the people are showing their signboard, they show the inscription of FRCS because it invariably and inevitably it adds to the prestige of the doctor if he has obtained FRCS from United Kingdom. 100% right, sir. We fully take your clarification, in a very, very in the absolute terms, because it gives us a very clear indication. Coming to the next question, Dr. Sir, very, very important question. You claim to be the specialist in such areas like vitreoretina, uvea, ROP, cataract, and refractory surgery specialist. I have never heard any doctor in Jharkhand or even in Bihar having specialization in all these areas, my dear viewers. I would absolutely unambiguously like to make it clear, I have seldom come across any such doctor who has so much specialities to his credit, barring our distinguished guest, that also was the pivotal region for my immediate bonding with such a qualified doctor from United Kingdom and from AIMS. So, sir, this is a very important question. So if you could kindly enlighten our viewers on the above, of course, in the layman's parlance, because we are non-medical people, sir, you would appreciate. Please, your take now.
So vitreoretina is basically that specialty of the eye which deals with the diseases of the vitreous and the retina. So vitreous is basically the gel that our globe is filled with, eye globe is filled with. And retina is basically the screen of the eye in layman's terms. So just like what, in a camera, the job of a reel is synonymous with the job of the retina in our eye. And that retina is made up of millions of nerve fibers. And so whatever we see, the image of that is basically formed on the retina, and that is from where it gets relayed to the brain. So that is a pivotal part in someone's vision. And retina is that part of the eye which is not visible from outside. Let alone its treatment, its visualization also is a pretty challenging part. And one has to master its visualization first before even trying to attempt a treatment for it. Retina has, it is an extremely sensitive subspecialty of the eye. Certain people, and in the ophthalmic fraternity, unofficially, it is labeled as the most difficult specialty of the eye. It is also that part of the eye which cannot be transplanted, donated, or can be artificially put till now commercially. So that makes a disease of the retina pretty, at least an urgent condition at the minimum. Most of the times it's an emergency, but usually it's an urgent condition. So when you treat the disease of the retina, the entire game of the treatment is to prevent the loss of vision. It's not to improve the vision, but to prevent the loss, because you are right now fighting with death of the eye, so to say. So you have to prevent the death, and that is where it gets pretty challenging. The surgeries are pretty long. They are the longest surgeries of the eye. Surgeries range from approximately 45 minutes to 1 hour to 1 hour to probably sometimes as long as 3 hours, 4 hours. Then comes uvea. So uvea is that part of uvea is basically the middle part of the eye layer. That again is not visible from outside. So uvea in our body, it is that part of the entire body, not only the eye, it is that part of the entire body which has the richest blood supply. So it having the richest blood supply is also prone to most number of pathologies which can be transmitted from blood. So whatever medical condition a patient has, there is a tendency to attack the uveal tissue. And that again is a very, very intricate subspecialty of the eye, which requires a lot of attention, a lot of time, a lot of examinations, a lot of investigations, a lot of systemic workups, a lot of blood reports, a lot of images, a lot of screening, everything. And the treatment is pretty intricate because you have to maintain a very, very fine balance between the benefits of the drug that you give to treat the disease and also to eliminate or prevent or minimize the side effects of those drugs, because these drugs are continued for a very, very long time. So there, the entire game is to balance everything. And that is a very, very tricky business. And it is also a very, very deep specialty of the eye. Thirdly, there is something called as retinopathy of prematurity, or ROP, which is basically a disease of premature babies. I mean, the premature babies' retina, they don't get developed. So if we don't treat the retina within 30 days of birth, the retina gets irreversibly damaged. So every premature infant is at risk of having ROP and consecutively permanent irreversible vision loss. So to save those small premature babies, sometimes who are only 7 months old, in the womb and they come out, like 28 weeks in the stomach and they come in the womb and they come out, babies as small as 1.1 kilos, 1 kilos, 700 grams. So treating those small babies to prevent their vision loss, injecting their eyes, lasering their eyes, operating on them, that is a very challenging specialty as well. So that is something called as ROP. Then cataract, as we all know, every ophthalmologist in the world, they perform cataract surgery. So cataract surgery is like removing the lens and implanting the lens. That's the most commonly done surgery of the eye. And fifth is refractive surgery services. So refractive surgery is basically spectacle or power removal surgery. So basically young people who don't want to wear glasses, they want to get it removed for cosmetic purpose, for examination purpose, or for whatever purpose, they undergo that refractive surgery. So that refractive surgery that's what refractive surgery deals with. It deals with surgeries including which results in spectacle removal. So those include LASIK or implantation of the lens inside the eye. So that is called refractive surgery. So these are my 5 specialties.
Fantastic. Great, sir. So one thing I would like to know, just from the perspective of our viewers, just now you just informed all of us that you also, especially in the context of operating a very newborn baby who is just 1 and 1.5 kg. So I think it must be a very difficult sort of operation where the chance of baby losing its vision, forever, that risk might be involved as well. So while undertaking that sort of operation, so don't you think that it is very risky and it causes some sort of trepidation, and additional trepidation in surgeon while undertaking such crucial operations? Your say on this, please. Because most of you surgeons can do it, as you happen to be one of them.
Sir, actually, the problem with those kind of babies is that if you don't operate, they are going to go blind. There is 130% chance that they're going to go blind. Surgery make no mistake, has a very, very, very low success rate in such babies. Probably 1%, probably 0.5%. And that is why treating those babies non-surgically early on is very important. Those babies reach that stage of requiring surgeries only when the treatment is delayed or the screening is delayed. So once, it's either basically that thing or the baby goes blind. So when there is nothing to lose, and so much to gain, then even if it's a 0.5%, I would want to give that chance to that baby, because for an old man, probably who is 85, 90 years old, and who's suffering from cataract, even if he doesn't get his cataract done, probably because of any reason, maybe he's medically unfit to go surgery, even if he loses both his vision at the age of 90, yes, it is unfortunate, but I would still settle for it rather than settling for a newborn baby losing both his eyesights completely at less than a month's age of his on this planet Earth. So rather than trying to, trying to give chance to someone who has already lived his life, I would rather prefer to give that 0.5% to a baby who is about to start his life.
Great, fantastic, fantastic revelation. My dear viewers, we have seen the way our very, very esteemed guest had tried to, just differentiate the nuances, and the way he dissected the overall, the delicate issue in such a simplifying manner that speaks a volume about the level of his skills and level of his, intellectual and his medical attainments. Thank you, sir. Coming to the next question, very, very important question. You claim to have undertaken several innovation techniques of retina treatment in Jharkhand. Rather, you are an innovator par excellence in the medical area so far as Jharkhand, the state of Jharkhand is concerned. Now, your specialties are failed retina surgeries, complex retina surgeries, and ROP. Your take on this, please.
Sir, before I came to Ranchi permanently, I also went to Milan to Professor Giovanni Storenghi. He is a genius when it comes to retina, and I was with him for approximately 3 months before coming back to India. And there I realized that there is so much of scope to do things in retina which are not done, not explored. And retina is a very vast specialty, and a lot of people surf the surface of it all only. They don't dive deep into the specialty, and they don't dive into the grim cases. And even if they dive into the deep and grim cases, there is a very superficial treatment that is given, whereas there are extremely deep treatments available. So I felt like if those treatment options can be brought to Ranchi, and if I am expert enough to do that, I mean, people of Ranchi, they deserve that world-class treatment. So I have started a lot of treatments which were done for the first time in the area of ophthalmology in the state of Jharkhand and Bihar. And I was the first one to bring in the latest medicines for retina, which were patented probably 2 weeks back before we made those drugs available, and we used it on a patient in a small place like Ranchi. When you see it in perspective of that drug being the latest one to get FDA approval, like on 8th of October 2020, there was a drug that was approved by the FDA for a treatment of a very grim retina problem. And in less than 2 weeks' time, that drug was used by us in a patient. Coming to think of it, use of that such an advanced drug in a small place like Ranchi, where we don't know what's authentic, what's not authentic, and there you are injecting patients with injections which are actually the first line of treatment in big institutes like Stanford University, Oxford University. Even AIMS did not use that drug at that time. So considering, I would say that yes, we have pioneered a lot of latest developments and changes as far as field of retina is concerned. About failed retina surgeries, yes, retina surgeries have a certain success rate. There is a success rate of probably 80 to 90%. when a surgeon operates. And when the surgery fails, it's probably not a surgeon's fault because they are trying their level best. But certain times those surgeries don't work and the retina gets into a trouble again. So you have to get inside, and when it gets into trouble again, it gets more trouble than what it was previously. So the success rate of a second surgery in case of a first failed surgery is further lower than the success rates of the first surgery. So that is a pretty dishy water, and a very, and that basically is a troubled water for any retina surgeon. So somebody has to put a hand into that. So I chose it, and by God's grace, yes, the chances of second surgery succeeding is probably 60%. But I'm glad that most of the second surgeries that I have done for a lot of failed retina surgeries have come out to be with a pretty good result. And that is also a part of the complex spectrum that I call as complex retina surgery. So complex retina surgeries also include failed retina surgery, previously failed retina surgeries as one of the components. Other components are complex diseases which have made the retina pretty anatomically abnormal enough to be deemed inoperable by people. So, when, as I said previously also, when there is nothing to lose and everything to gain, I would like to take that 0.5% chance if there is available.
Great, sir. Great. My dear viewers, you have seen, he is an epitome of confidence. In fact, just a very defining meritocracy in the resplendent of terms. And that, the facial confidence, which is which is adequately complemented and supplemented by gestures, that itself speaks a volume about the sort of confidence that youngest, very young doctor, our very, very esteemed guest, has in himself. And that is, he has redefined the medical boundary of the state of Jharkhand. I would rather say in the eastern zone. Though he, out of sheer modesty, he is confining himself within Jharkhand, but I say within the eastern zone, he is redefining the medical boundary. Thank you, sir. We are straightway coming to the next question. The next very, very important question. You claim to be the first and the only retina surgeon till date of Jharkhand to have multinational, multi-centric clinical trials running under yourself in the capacity of a principal investigator. So please, your take on this.
So, sir, clinical trials, basically what they mean is whenever there is a new drug being launched, and after its safety and everything is tried and tested, then they are given to doctors with certain qualifications, certain degrees, and probably that is where your question is also answered. The question that you answered, what is the use of these FRCS degrees? So these FRCS degrees are the ones which are the quality standards for someone to choose a principal investigator. So when you choose a principal, I was chosen as a principal investigator. So what these investigators do is they basically test the effect of the drug on their patients. So there are poor patients who are not able to take treatment because of money constraints. So I explained to them that this is a new drug, and this is a trial, and you won't be charged, but we will be injecting this injection to you. It has proven to be good. So if you consent for it, we would want to inject this and see if your eye improves, and you will improve. I mean, this is a tried and tested. It's not like I'm making you a guinea pig. No, that phase is some other phase. This phase is not a guinea pig phase. This phase is basically when you inject a drug or use a drug in a patient, the drug which is deemed fit and suitable to use for humans. They have already been tried. They have already been cleared. Then before making those drugs commercially available, they need to be cleared by a certain set of doctors with respect to every parameter, whether it's safe, whether it's having any reaction, is it having the effectiveness that it is claiming it will have, whether the outcome is good. So a lot of things goes into being a principal investigator. You have to have the kind of qualifications that you have. You have to have proper setup. You have to have patience. You have to have very meticulous documentation of each and every single thing. And you have to share with the trial people every single thing that you're doing. And there are so many plethora of tests that are done before and after subjecting a patient to that injection. So basically, you are standing as a person who is having the authority to say if a drug is okay or not. In gross terms, that is what is a principal investigator. So when I say a multi-centric trial means a trial which is being run at multiple centers within a country. And multinational means that trial is not only run in that country, but it is also run in other countries. So that's called a multi-centric multinational trials. So in India, probably 14 centers are there who are running this trial. And in Jharkhand, we are the only one, first and the only one to be running that trial for retina.
Great. So my dear viewers, once again, I would like to, Dr. Saab has, though time and time again, I've already made it clear, but he is talking about, that is Kashyap Memorial Hospital, of which he is a deputy director. When he says that we are institutionalizing that sort of investigation, he is indicating about Kashyap Eye Memorial Hospital here in Ranchi. Thank you, Dr. Saab. We are straightway coming to the very next question. Dr. Saab, you are, of course, a very, very young leader, but a leader who is a change agent. My dear viewers, our Honorable Prime Minister is a change agent for the nation. Dr. Vibhuti Kashyap is not only a change agent for Kashyap Memorial Hospital, but a change agent for the state of Jharkhand. And of course, though in microcosm, but nevertheless in a very tangible measure, he happens to be a change agent for entire Eastern zone. And in the future, we are looking forward to his evolving as a change agent in the medical arena across the nation. So, Dr. Saab, coming to the very important question, under your leadership vision, Kashyap Memorial Eye Hospital became the first hospital in Jharkhand to start official vitro retina fellowship. You trained young ophthalmologist, the most sensitive and perceivably difficult specialty of the eye, that is retina. Please, your take on this, Dr. Saab.
So, sir, what happens is that there are multiple small hospitals and individual doctors who, in their own capacity, they start fellowships for various things, for various training things of ophthalmology. But unfortunately, those fellowships are not standardized. Again, as I said, they are all unofficial. They are not recognized. It is just like having a medical college which is not recognized. These fellowships run by individual doctors under their name. They don't have a degree. They don't have a formal degree. They can't, the trainees trained under them cannot claim to be officially trained under them. Their certificates are not official. It's just like accompanying those doctors, probably, being with them, hanging out with them in certain procedures, and in that process, probably pick up a few things here and there. So that is pretty inadequate training. What we have started, that training has a national permit, a national recognition, recognized by the government of India. And needless to say, before that recognition, it has to go through a very strenuous scrutiny as to what is the number of patients in your OPD. Will they be able to learn enough? Do you have enough patient load for them to learn? Do you have enough instruments for them to get exposed? Do you have enough exposure? Do you have enough instruments for them to practice their stuff? Do you have enough variety of instruments for them to be adequately learned? Do you have adequate number of surgeries? Do you have adequate number of surgeries in all specialties? Do you have all specialties of eye? Do you have a facility for their reading? Do you have their facility for their training with respect to surgeries? Do you have can those students practice in goat's eyes? before handling the human eyes? Do you have qualified enough surgeons to be labeled as trainees? I mean, I'm not talking about any Tom, Dick, and Harry getting up and saying, "Oh, I can train this person." No, you have to go through that process. You have to go through that process of passing the scrutiny, after which you are labeled as fit enough. So currently, we are the only institution in Jharkhand, first and the only one, to be giving a recognized fellowship in training of retina.
Great, great. Now I'm coming to the very important question, Dr. Saab, because we are almost coming to the end of the program, and with all few very important questions of huge gravitas. You claim to have incorporated one of the world's most advanced microphone for retina surgeries. Kashyap Memorial Eye Hospital claims to be the #1 in East India. Please, your take on this, Dr. Saab.
So, sir, this microscope, I mean, I cannot take the company's name because of patenting reasons. So this microscope is one of the latest in the world. So how does it help in retina surgeries is, as I said before also, the key to be doing a treatment of retina is basically the visualization, because it is not visible from outside. So you have to spend a very considerable amount of time to try to learn to see the retina first before you attempt at even treating it. So this is what emphasizes my point, that visualization of retina is very important. So what this microscope does is it enables the visualization of retina intraoperatively very clearer than every other microscope. So when I first used it, when the microscope came to me first for the demo, I realized the stark difference between the clarity of the microscope that we had been using at our hospital versus the clarity that this microscope gives me. And this was equivalent, even if not superior, at least equivalent to the kind of microscopes we had at AIIMS. I was finding no difference between between the kind of ease, the kind of visualization, the kind of clarity I had at AIIMS when I was operating versus when I was operating under this microscope. And that was very significantly clear from the microscope that we were using. So we instantly took that microscope up. It basically adds up to the quality of the retina surgeries that we do at our hospital. And the company that we bought it from, it claims that company claimed to me that your hospital is the first, officially, that your hospital is the first hospital in entire East India to have taken that microscope for retina surgeries. So that is what I...
Great, Dr. Saab. Now I'm coming to the next question, very important, Dr. Saab. Actually, this is something to do with me as well. So, often I have spotted doctors displaying FRCS Part 1 at many places, at sundry many places. So what does it actually signify? In fact, having qualified the double FRCS from United Kingdom, you are the best person to explain the significance of this particular, the ostentation, I would say, appearing in the signboards of some of the doctors here and there. So what is the connotation and significance of that? You are the best person to explain to our viewers. So what is this Part 1 FRCS mean? Please, Dr. Saab.
Sir, actually, it's a very controversial question that you have asked me.
No, it's a technical significance.
Huh?
A qualified person, you should know its connotation, its overall significance. So what is the significance of FRCS Part 1? It is in the mind of, it must be in the minds of our viewers also, that what exactly does it mean?
So, sir, FRCS 1 basically means that you have passed the first stage of the 4 stages that I told you. The first and the most basic stage that usually junior doctors, they pass during their training, and that is about it. That is all they have. So it's basically like, I mean, you're just trying to make me say it. It's just that you have cleared the first step of a pretty lengthy process of getting an FRCS. So it's just a first step. I mean, I should speak just that, because
That
anything more would be like maligning people. But I've just said what is technically right.
great, sir. My dear viewers, it is just like, say, for example, those who are taking the civil service examination, just qualifying in prelims and failing or skipping the mains examinations and interview, but just by virtue of clearing entrance, they are claiming that I have become or I have done a part of an IS. As simple as that. This is what
No,
is
actually, no, sir. Because if you just clear the prelims, you have the mains and then you have the interviews. So if you clear prelims, you clear 1/3 of it. But
Right.
in FRCS, you have 4 parts. So if you clear the first step, you have not cleared 33% also, you have cleared just 25% of it.
Okay, great for so actually, my dear viewers, it
I mean,
becomes
sir,
very-
I really don't mean to, offend anybody. It's just that because it's on live and you have asked me, and, I mean, pardon
my
me
dear, my
for hurting
viewers,
people's sentiments.
there's no question of any amount of means any malicious propaganda, anything, any malice about the overall question, because this is out of curiosity. We all would like to know as to what is the connotation and significance of this, because there are doctors everywhere in Patna also I have seen they are so proudly they exhibit this particular inscription in their signboard, that FRCS part 1. So it aroused curiosity in me to know about its technical significance. And that's our viewers also often, when they come across all these sort of designations, all these sort of inscriptions, obviously the question might take a tangible shape in their minds as to its overall connotation and significance. As simple as that. So I am coming to the last question, very, very important. You are a role model for Jharkhand as of now, for the eastern region as of now. Of course, you are would be a role model for the nation. My dear viewers, it becomes very important for me here to say that often I say, I just talk about this particular case scenario in seminars, national seminars, that what is the special quality of Mr. Shahrukh Khan? If some, because he is neither very tall nor does he very handsome person, but despite his ostensible deficiencies, he has become the superhero or superstar of Bollywood. There in fact is one quality of Mr. Shahrukh Khan, which by virtue of which he outshines his peer group, and that very quality is that his level of confidence. There is a very, very important incident in Ramayana, that whoever would come to Bali, he would lose half of his strength. Whoever would come to Shahrukh Khan, he or she would invariably lose half of his means strength. Likewise, our doctor, our esteemed guest today, happens to epitomize that sort of confidence. And I congratulate him, compliment him, and wish him all the best from this august platform of Education Pe Charcha, that he definitely has all qualities and potential to shape up as a role model for all the medical aspirants, all the medical doctors who are aspiring to be as good a doctor as our esteemed guest is. So that's why I designate him, or rather I would love to dub him as a role model for medical fraternity, for all those who are aspiring to be good human being and a very competent doctor. Sir, I'm coming to the last question. Jharkhand has a significant proportion of Adivasi population, which is economically deprived class. Do you have any particular vision to serve them? Your take on the same before I invite Pramodji for summing up in Hindi. Please, sir, your last.
So, sir, Jharkhand is a place where 70% of the people are actually economically weak. BJP has already done a fantastic job by getting Ayushman Bharat scheme to our country. And yes, I mean, I will not shy away from saying that it has its own limitations and there are a lot of work needed to fine tune it, but it has to a very, very large extent taken care of the hospitals which genuinely try to take care of those patients who come from that background. So I have been I have actively tried to at least cater to that section of the society who are in need of a major eye surgery, not a cataract, because cataract through Ayushman Bharat, I don't think that's my personal opinion, not a professional one. I would say cataract through Ayushman Bharat doesn't solve a purpose, because any which ways there were camps before that also. There was a DBCS scheme also. So getting a cataract surgery done for a poor patient was never a big deal anyways. There were camps all over the state, all across the year, every month, every week. Any new hospital prongs up, and they go for camps, they operate. So poor patients did not need a support for cataract surgery. But what they have done is they have supported us for these super specialty surgeries, which are pretty expensive, but they are getting covered by Ayushman Bharat, and that is where Ayushman Bharat has been a game changer, and that is how we have tried to be helpful to these Adivasi tribes and the non-Adivasi poor tribes.
Great, sir. My dear viewers, before I pass it on to Pramodji for his just summing up in Hindi, today's very electrifying interaction between me and our very distinguished guest, Dr. Vibhuti Kashyap, a phenomenon in Jharkhand. I would like to recommend this video for everyone, either in medical field or in non-medical field, for their own enlightenment pertaining to the very knowledgeable, very knowledgeable conversation between me and Dr. Saab, because Dr. Saab through this August platform has furnished all vital information pertaining to that of eye surgery. My dear viewers, our next esteemed guest on 3rd of June is Dr. A.K. Barma Sahab, a pediatrician from Mekon Hospital. He is going to be our next guest, Dr. Sri A.K. Barma sir. A.K. Barmaji. Now, Pramodji, it is your time, please. Sri Pramodji, I invite Sri Pramodji just to sum up today's very intellectually scintillating and educationally illuminating, conversation between me and Dr. Sri Kashyapji. Please, Pramodji, please.
नमस्कार आप दोनों को आदरणीय श्री विभूति जी और आदरणीय श्री विवेकानंद जी, मैं आप लोगों को सुना जा रहा हूँ। एजुकेशन पे चर्चा का ये 97वां सेशन, इसमें हमारे झारखंड के विद्वान डॉक्टर श्रीमान विभूति जी ने बहुत ही विस्तार अपने क्षेत्र की चिकित्सीय क्षेत्र की जो आंतरिक स्थितियां हैं और उसकी जो संभावनाएं, उन संभावनाओं को और उन संभावनाओं से होने वाले समाज के ऐसे लोगों को जिनमें परिवर्तन की जरूरत है, उसकी बात हमारे और आपके सामने रखी। पूरे कार्यक्रम में आपके प्रश्न और उनके उत्तर दोनों को मैं बहुत ही ध्यान से सुन रहा हूँ। सामाजिक रूप से एक सामान्य ऑब्जर्वेशन है लोगों का कि डॉक्टर की जरूरत दैनिक रूप से बहुत ज्यादा बढ़ गई है, और इतनी ज्यादा बढ़ गई है कि जितने राजकीय चिकित्सालयों में भीड़ रहती है, उससे कम निजी चिकित्सकों के पास या विशेषज्ञों के पास नहीं होती। हमने देखा है कि पिछले 5 से 7 वर्षों में पूरे देश में और झारखंड में भी बड़े बड़े स्पेशलिस्ट हॉस्पिटल खुले। इन हॉस्पिटलों ने विशेषज्ञों के साथ निश्चित रूप से अपने देश के लोगों की परेशानियों को कम किया है। और ये परेशानियां लगातार कम होती हुई नजर आएगी, जबकि एम्स से पढ़े हुए विभूति, डॉक्टर विभूति जैसे विद्वान और विभूति जी के अलावा ऐसे बहुत सारे लोग हमारे बीच में, खासकर धनबाद, झारखंड, रांची, जहां आज भी कई ऐसे गांव हैं जिन गांव में कई ऐसी अज्ञात बीमारियां आंखों को लेकर आती है, जो कई बार चिकित्सा के क्षेत्र में लगे हुए लोग तो परेशान रहते ही, क्योंकि ये सौभाग्य मुझे प्राप्त है कि कई जगह पर आई कैंप लगते हैं और उन आई कैंप में कैटरेक्ट के इलाज के लिए बहुत सारे लेंस और चश्मा दे करके और वहां के स्थानीय ग्रामीण लोगों को 1-2 दिन 3 दिन 4 दिन के अंतराल में उनके लिए एक अच्छी चिकित्सा की व्यवस्था की जाती है। मैं फिर से एक बार कहना चाहता हूँ कि डॉक्टर विभूति ने इतने कम आयु में जितनी गंभीरता से इन चीजों को लिया है, और इनके परिवार के सभी लोग चिकित्सक हैं, मैं इसी शुभकामना करता हूँ कि आप आने वाले भविष्य में भारत को एक अच्छे आंखों के लिए अच्छी चिकित्सा जो अंतरराष्ट्रीय स्तर के वैल्यू की हो, जैसा कि आपने कहा, हम लोगों के लिए उपलब्ध। लेकिन साथ ही मैं ये भी निवेदन करूंगा कि आप अपने फर्टिलिटी के लोगों को लेकर के पूरे झारखंड में किसी एनजीओ में कोई ना मिले तो मैं हूँ, आप जिस दिन आमंत्रित करेंगे या अपनी इच्छा जाहिर करेंगे, पूरे झारखंड के लोगों को भी ये संवाद जाना चाहिए और कोई एक आधा घंटा उन गरीब वनवासियों के लिए निकाला जाना चाहिए, उनके घरों तक जाना चाहिए और उन तक ये सारी व्यवस्था मैं करूंगा यदि आप पूरे झारखंड के डॉक्टरों की टीम बना लें और उनकी सेवा भी करें, क्योंकि चिकित्सीय क्षेत्र एक सेवा से उत्पन्न क्षेत्र है। भले ही अभी अर्थ की बहुत ज्यादा प्रधानता होने के कारण उसके बगैर कोई कार्य चलता नहीं है, लेकिन इसके बावजूद भी जो गुणी लोग हैं, जो धनी लोग हैं, जो विद्वत लोग हैं, जिनको राष्ट्र से प्रेम है, स्नेह है, वो अपने राष्ट्र में रहने वाले सभी मानविकी की सुविधा के लिए सरकार की ओर नजरें न दौड़ा करके आपस में सारे लोग बात करके उसकी व्यवस्था करके और उनको चिकित्सा और उनको सुविधाएं पहुंचाते हैं। पिछले 97 सेशन से देश के जाने माने विद्वान, जाने माने चिकित्सक, जाने माने देश के रक्षा विशेषज्ञ, रक्षा में कार्य करने वाले लोग, नवोदित भविष्य के जागृत युवा, ऐसे सभी लोगों से बातचीत में शामिल होने का सौभाग्य आदरणीय विवेकानंद जी ने हम सबों को दिया है। और न केवल इतना ही, हमने यह भी व्यवस्था करी है कि एक साक्षात एक विद्वता के माध्यम से जो आभासीय दुनिया है उसमें भी कुछ सकारात्मकता का मुद्दा है, तो उसके लिए भी हमने एक व्यवस्थित चिंता जाहिर की है और उसमें हम धीरे धीरे आगे बढ़ रहे हैं। मेरी शुभकामना आदरणीय विवेकानंद जी को है कि हम आप मिलकर के इन चीजों को गतिमान करते रहे। आज के इस अवसर पर मैं हृदय से श्रीमान विभूति कश्यप जी को साधुवाद देना चाहता हूं कि आप अपनी व्यवस्थाओं पे, अपनी व्यस्तताओं के बावजूद आपने इतना गंभीर समय निकाला। आप हमारे साथ 1 घंटा से ज्यादा समय तक रुके और आपने अपने अनुभव, आपने अपने ज्ञान और आपने अपनी शालीनता, विद्वता से हम लोगों को आह्लादित किया। ईश्वर आपको सक्षम करे, सफल करे, यशस्वी करे, यही मेरी हनुमान जी से प्रार्थना हो। बहुत बहुत धन्यवाद।
Thanks a lot, Pramodji. My dear viewers, indeed it is true. What Pramodji said is absolutely true. We are so thankful and we express our deepest sense of gratitude to our very, very beloved guest today, Dr. Sri Vibhuti Kashyapji, who despite being, very, very young today, so far as the medical profession is concerned, but nevertheless has earned an impeccable sort of reputation of being a very, very talented doctor, talented surgeon, eye surgeon. In fact, unequivocally, the best surgeon, the most qualified surgeon, eye surgeon of entire state of Jharkhand. Even Bihar may be included. But Bihar may have one or two. But Vibhuti ji happens to be the youngest, most qualified doctor in the Eastern zone, and even at the national level. And just as Pramod ji says, the way he has given his valuable time for an intellectual interaction with me, sharing with me all the his achievements right from Ranchi, which began from Ranchi, went to Mumbai, and then with All India Institute of Medical Science in Delhi, and finally in London, United Kingdom, where he did double FRCS. He had shared his varied experience with all of us and enlightened us, enlightened us with the ins and outs of the different aspects and dimensions of that of medical profession. We very much thank him from the core of my heart. I recommend this video for one and all. Kindly watch this video because it is meant for enlightening all of us on the various facets of that of medical profession. With these words, I once again make an announcement. Our next guest on next Saturday on 3rd of June is Dr. Sri A.K. Barmaji, a pediatrician from that of Mekon Hospital. He is also a very great doctor. He is going to be our distinguished guest. Thank you, Dr. Vibhuti ji. Thank you, sir. Thanks a lot.